Altered mental status refers to any change in consciousness, cognition, or behavior, and represents a critical clinical presentation. It has a broad differential ranging from metabolic and toxic causes to neurologic emergencies. Immediate evaluation is essential to identify reversible and life-threatening etiologies. Common causes include infection, hypoxia, hypoglycemia, electrolyte imbalance, organ failure, toxins, trauma, stroke, and seizures. The AEIOU TIPS mnemonic helps recall key causes including alcohol, epilepsy, insulin abnormalities, overdose, uremia, trauma, infection, psychiatric causes, and stroke. Altered mental status is very common in emergency departments, intensive care units, and elderly populations. Delirium occurs in 10 to 30% of hospitalized adults and is often underrecognized. Pathophysiology involves disruption of neuronal function, neurotransmitter imbalance, or direct brain injury. Multiple factors often coexist, such as infection, dehydration, and sedative medications. Initial assessment must focus on airway, breathing, and circulation stabilization. Rapid bedside checks should include glucose and oxygen saturation in all patients. History should assess onset, duration, associated symptoms, medication use, and substance exposure. Physical examination includes vital signs, neurologic assessment, pupil response, and signs of trauma or infection. Look for focal neurologic deficits, which may indicate stroke or intracranial pathology. Differentials include delirium, dementia, psychosis, post-ictal states, metabolic encephalopathy, and structural brain lesions. Laboratory evaluation includes complete blood count, electrolytes, renal and liver function, glucose, arterial blood gas, and toxicology screen. Brain imaging with computed tomography or magnetic resonance imaging is required when focal deficits or trauma are suspected. Lumbar puncture is indicated if central nervous system infection is suspected. Electrocardiogram and cardiac markers help evaluate arrhythmias or cardiac causes. Management begins with stabilization, followed by rapid identification and treatment of the underlying cause. Correct hypoxia, hypoglycemia, and electrolyte abnormalities immediately. Discontinue sedatives or offending drugs contributing to altered sensorium. Provide supportive care including hydration, oxygenation, and patient safety measures. Delirium management focuses on environmental control, reorientation, and avoiding physical restraints. Low-dose antipsychotics may be used if severe agitation threatens patient or staff safety. Complications include falls, aspiration, prolonged hospitalization, and long-term cognitive decline. Prognosis depends on the underlying cause and how quickly reversible factors are corrected. Persistent deficits should prompt evaluation for structural or neurodegenerative disease. Always assume new onset confusion is due to an acute medical condition until proven otherwise. Altered mental status is a medical emergency requiring rapid stabilization, systematic evaluation, and targeted treatment using the AEIOU TIPS framework.